Hello, my name is Xin. This is for my intramuscular checkoff. And before I enter the patient room, I should check the healthcare provider order and for the patient's allergies. So the order is intramuscular influenza vaccine, and the dose is zero point 0.5, and intramuscular, and the patient is Anna Pulaski, and it says she's allergic to penicillin. And I'm gonna knock the door and enter the room and wash my hands. Hello, my name is Ying, and I'll be your student nurse today. Today I am going to give you intramuscular influenza vaccination. Before we start, can I have your name and date of birth, please? And the patient, I'm gonna check if the patient's words matches on the patient's armband, and it matches. And after that, I'm gonna ask the patient about any allergies, and I'm also gonna check the allergy band. And she's allergic to penicillin. I'm gonna ask what penicillin gonna do to the patient, and the patient gonna see like she gonna develop a rash. And after that, I am gonna use the extract to verify the medications. So the patient is Anna Pulaski, and the dose is 0.5, and the route is the intramuscular, and this is the correct time. It's 14:58. It is here. And the route is intramuscular, and I'm gonna document it after I check the 6 round. I need to check for my medications influenza vaccination. Okay, and I'm gonna document after that. And I am gonna use the IM injection site of the deltoid. So the deltoid is 2 to 3 fingers below the acromion process. So it's like right here. It's like right here, and I'm gonna get all my supply and equipment. And for the syringe and needles, I use a 21 gauge with 1 inch of the needle, and the syringe is 1 ml. And I have my gauge and alcohol pads, hand sanitizers, my labels, my vaccinations, and clean gloves, and my electronic record, and the sharp container on the side for the syringe disposal. And after that, I'm gonna check the prescription of the healthcare provider for the patient's allergies, and giving the patient education about the med. So this is the worksheet I got with my name up here, and the influenza vaccine is used to prevent the flu, and there are some common side effects, which are local soreness, fever, myalgia, possible neurological toxicity. If you develop any of these, please let us know immediately. And I'm also gonna check the sign or symptoms for the flu to see if this might work as well. And I'm also gonna check the white blood cells. And there's like a note to myself. I'm gonna avoid using the patient with acute neurological compromise, and the patient Anna Pulaski should be okay. And after that, I'm gonna check my 6 thread again. So the patient is Anna Pulaski, and it is Anna Pulaski. The time is correct time. It's correct time, and the route is intramuscular. It is intramuscular, and it's a 0.5 milliliters. It is 0.5 milliliters, and the route is intramuscular. And I'm gonna document it after I'm done checking that. So I am gonna wash my hand again in order to prepare the medications. First of all, I'm gonna clean the rubber stopper with my alcohol pad really hard for 30 seconds. Okay. After I'm done, I am gonna label this one. So with the time and then the date with the today's date and the initial on the label. And I put the label on my syringe. Not my syringe, on my vial. And after that, I'm gonna draw back to the air to equals with the outer dose, which is the 0.5 ml. So I'm gonna draw back 0.5 ml. And I'm gonna insert vial and withdraw appropriate dose of the medication. I'm gonna inject the air into the vial. It's air to air. And I am gonna invert the vial and withdraw for 0.5 of the influenza vaccine now. And there are some air bubbles, so tap it and try to. I draw like a little bit more than 0.5 so I can get rid of the air bubble if I need. And there are some air bubbles, so okay, that's good now. And after that, I'm gonna label my syringe as well with the patient's name, which is Anna Pulaski. Anna Pulaski. The medication is influenza vaccine. The amount is 0.5 milliliters. And my initial and the today's date and time. And I'm gonna check the healthcare provider and the patient allergies one more time and verify the 6 thread at the patient's bedside. And the patient name is Anna Pulaski, and the route is intramuscular. It's intramuscular, and the 0.5 milliliter of the influenza vaccine is 0.5 milliliter influenza vaccine, and the time is correct time. And I'm gonna document it as well. I am gonna wash my hand before I touch the patient, and don the glove. I'm gonna position the patient with relax and at the side and let the patient to sit down on the chair and put the arm on the firm surface. So I'm gonna use the deltoid. So this is my arm. And before I inject it, I'm gonna clean the skin. In a circular motion. I start center and then moving forward, moving outward. And after I clean the site, I am gonna use Z-track. I'm gonna use Z-track technique, which I'm gonna like push it from like one side. Sorry. And then I insert my needle at 90 degrees. And I am gonna inject my medication really slowly, like 5 to 10 seconds. Okay. After I'm done with the injection, I am gonna move my window and release the Z-track position. And I'm gonna engage the safety and then dispose it to the sharp container. So right here, and I am gonna use the gauge to apply the gentle pressure on the patient's side. And I am gonna like to clean my all the waste, and then I'm gonna remove my gloves. And after that, I am gonna document like the administration of the medicines. And before I leave the room, I'm gonna check the safety environment for the patient, which is the bed is like the lowest position, the collapsing rates, the scenarios up, the brake is on, there is no cluster on the ground, and ask the patient if the patient feel comfortable, and do you need anything before I leave. And I'm gonna open the curtain for the patient as well, and I am gonna wash my hand again.